And we are back with the Boston Congress of Public Health 40 Under 40 Public Health Catalyst Awards program and podcast. We have another guest with us tonight, Sana Farooqui. Sana, how are you doing?
I'm great. Thank you, Candace. Thanks for having me.
Absolutely. We were super excited. All of us at BCPH loved your application. You are doing fantastic things in public health and beyond. So wanted to have this interview for people to get to know you a little bit better. First off, tell us where you're calling it from.
I have moved to Houston, Texas, so away from the East Coast and now down in the Southwest.
Oh my goodness. So Sana, tell us a little bit about where you're from originally, and give us a flavor of some of the things that you're doing. I know you're a director of operations of a hospital and director of public health initiatives, but I cannot possibly do your intro justice. So go ahead.
So I'm originally from Maryland, a little town called Burtonsville, which is a suburb of DC. Right now in Texas, as you said, I'm the director of operations of a small legacy hospital in the Houston area. I think it's about 100 years old. I joined last October, so it's almost been a year now, when this hospital went bankrupt and I was recruited to help bring it back to life. What's really interesting, and I think it really ties into the theme of helping underserved communities, focusing on health equity, which has been a constant theme throughout my life, is that this area is in a medically underserved designated area, and the nearby census blocks have been slowly gentrifying. So we want to keep that community flavor for this hospital. So it's been an incredible year, and I can't wait to add more community health initiatives in the hospital as I move forward.
Okay, great. Well, I think there's so much to this, like turning around a hospital, like amazing work. Can you tell us a little bit about some of the surprises, the challenges, the awesome moments along the way of making this happen, like a legacy 100-year hospital? That's incredible.
Yeah, so actually, I never realized how much construction and contracting would be involved in turning this around, because we physically had to turn the 7-floor building, which was in disrepair after the big freeze last February, and make it suitable to be a hospital. So from that point of just cleaning up all the mess and debris that was in the hospital, to fixing up drywall and making sure doors are according to ADA code, and making sure that we got the appropriate licenses and city permitting and state licenses and federal licenses, all the way from like that beginning point to now staffing it and getting the proper equipment and starting the actual surgical service lines and all the actual operational problems. It's been a whole spectrum of reopening a hospital, and it's been an incredible experience, honestly, seeing us build a hospital from the ground up, essentially.
What are some things that surprised you, like when you took on the job and you were either in a positive or negative way, you were expecting one thing and then you got another?
I think how many things that you don't notice and you take for granted. So I visited a relative who was in the hospital a few weeks ago, and before I took this job, you don't really think about, okay, so where's the sink in a patient room? What kind of handles do you need for that patient? Like, can they open it with their elbow so it's sanitary and they don't have to touch it? Does every room have a hand sanitizing station? How far is the nurse counter or nurse station from each patient, and how many rooms can she visually see? Like that whole building layout, um, and how that corresponds to compliance and quality codes was a very eye-opening experience for me.
Wow, it sounds very, very fascinating. I love it, obviously, as someone, who's very fascinated by operations. Just an incredible thing for you to be a part of. How about we switch gears and we talk about being Director of Public Health Initiatives for, is it NCP Management? Tell us about some of those initiatives.
So NCP Management is the management company of the hospital. So in my role as director of operations, that's more of a day-to-day role in the actual hospital. And as in my role as director of public health initiatives, we are trying to connect the mission statement of the hospital with the overall organizational goal, which is better care at better access. One of the projects that we're working on now is teaming up with and contracting with FQHCs, federally qualified health centers, so that we can provide these health centers, which really serve and cater underprivileged and communities that really have a lot of barriers to care. We want to connect with these health centers so that our hospital can help provide and buffer some of the services that these centers can't provide, and connect our providers and physicians so that there aren't as many, the barriers to care are lowered in ways that traditionally wouldn't have been.
All right. And if we can talk about your public health journey, how did you get even involved in public health? You have a background in a number of other areas, undergrad as well as a master's before you got your master's degree in health management at Harvard Chan School of Public Health, which is where I met you. So about that whole journey and that passion, I guess, for public health.
Yeah, actually, I never, I know some people that who were interviewed for this, they always envision themselves in public health. I actually did not envision myself working in healthcare in high school or undergrad. As you correctly said, my background is not in public health. It is in government and politics and then international development and security. But I think after I got my first master's in public policy in international development, I went abroad to India, and one of my first projects was working with a orphanage system abroad, and helping them get healthcare access and resources for the network of orphanages, right? And that's when it really hit me how interconnected healthcare is with every aspect of your daily life or of any daily life. And no true development can't happen without incorporating healthcare. So when I came back to the States, I got an opportunity to work at a healthcare startup, which focused on something similar, lowering barriers to care and connecting uninsured folks to services that they may need here in the US. And that's what prompted me to actually fully invest myself into the healthcare and public health space.
Absolutely. And one thing, that I love, is, having a background that is multidisciplinary and multifaceted, is meeting people like yourself who have that, the government, the politics, international development, and public health. So this might be an interesting exploratory question, but in your mind, Sana, how do you feel your other areas of expertise lend themselves to you doing the public health work that you do now?
I think it's all very interconnected, right? Like, yes, they are separate disciplines, but we can't work in silos, right? And what we've learned at school, at Harvard Chan, is that everything is, we can't, when we solve problems, we really have to look at it at a systems perspective. And one of the major stakeholders in looking at solving issues from a systems perspective is government. Politics plays a role in that. It's also looking how one problem is affected not just domestically, but also is connected with international issues. And I think, the past 2 years with the COVID pandemic, we have seen how we need a multidisciplinary approach in fixing and solving public health problems. So I think the only way forward is through a multidisciplinary approach, right? We can't just silo healthcare and public health and not expect other stakeholders or other disciplines to not be involved.
Absolutely. And so then I'm going to turn towards your work in equity, diversity, and inclusion, which is something that we shared in common, but would love to talk about any projects that you've done in that area that you feel particularly proud of.
Yeah, obviously, I was at where I met you. I was an equity, diversity, and inclusion fellow at the Harvard Chan School of Public Health. One of the projects that I was very excited to work on and kind of lines up with, leaving a legacy is working on the academic aspect of EDI. So myself and the office that deals with the curriculum, and I'm sorry, that the name is slipping. It's been almost a year and a half. We went through all the case studies that the school uses in its entire curriculum and really categorized it from an EDI perspective. So even if you were a student in health management or in social and behavioral sciences, you had case studies that were um, offering or helping you look at the problem in multiple perspectives. So when you got into the quote unquote real world, right, you're not just living in a vacuum. You know what questions and what perspectives you might need to incorporate in your real world solution.
Absolutely. And I do vaguely recall that was a pretty extensive project, kind of going through all of those different case studies. Is there one in particular or more that stand out to you that was challenging or more, I guess, influential?
I'm sorry, I can't remember off the top of my head, Candace. It's been a pretty eventful year and a half, but I can look back and check back. But I mean, it was I think about 65 cases, so quite a few cases to go through.
Absolutely. No problem. So, Sana, I noticed that you said one of the things you do in your spare time is helping out with voter and citizenship initiatives, which I found very unique. I have actually never seen someone say what they do in their spare time as something basically like one might consider a full-time job. So tell us a little bit about kind of things that you've done there.
Yeah, sure. And I think this goes back to like the whole government politics aspect of my background. So starting from undergrad, one of my professors actually required us to go to on election day to a polling place and do exit surveys for minorities. So we would, I guess, profile people who we thought were minorities, and even if they weren't, that's fine. We just get more surveys to look through and see how they experience getting being able to exercise their privilege to their right to vote at this particular voting place. And I've done that consistently for almost the past 10 years now, even throughout the midterm elections. So every election day, you can find me at your local polling place handing out exit surveys to make sure that there's no voter discrimination happening, that people are comfortable in where they're voting, and that their right to vote is not being impeded on, which is increasingly a concern. In Houston, because of its proximity and because of its politics, one of the cool things that I was able to work on is helping legal aid and lawyers in connecting with immigrant communities who are filling out their citizenship applications, and just guiding them through it so that there's one less step for them to take when they submit it. So a lot of time it's not the sexiest thing. You literally go to like a community center, you have a whole line of folks with their 20-page application. You go through it, make sure everything's correct, make sure they understand what's needed, make sure there's no red flags for the lawyers sitting on the other end of the hall who do the final step and final review.
Love it, love it. It kind of sounds like some of the work that I've done in terms of being on the ground with vaccine distribution, helping to give vaccines to people.
Exactly. Yeah. It's not exciting, but it has to be done, and there's a reward that's separate from that as well.
And so I want to see if we can segue into this. Let me see if you'll go there with me. So in a number of different episodes that we've had for the 40 under 40, we've talked about social determinants of health, right? Um,
Mm-hmm.
Such as one's education, one's income, housing, the built environment, etc. But one thing that I feel that we can segue into is the political determinants of health, given the fact that you've talked about these exit surveys that you've done. So can you tell us a little bit about political determinants of health, and anything relevant to some of the work that you've done.
Yeah, and I think especially here in Texas, we seem to think that, you know, they're red states, blue states, red, blue, like cities, etc. But it's all intermixed, right? Just because like you live in Boston, I live in Boston, I came from DC, just because they're predominantly blue doesn't mean that everyone's getting the same experience that we would think occurs in a blue state, which is why even in Maryland, I mean, there were these voting, the poll monitor opportunities. I think when you think about the political sphere, it's not as clear cut. And when we kind of like with the recent abortion and Roe versus Wade debate coming, I've heard a lot of comments about let's cut the entire South away. I live in Texas. There were comments about, you know, everyone should move from Texas, but that's not possible, right? There's a lot of people who live here who are also fighting. So when I think just to sum that up, like it's not you're either red or you're blue, and your level of healthcare access or your level of socioeconomic opportunities is based off of that. It's a bit more complicated, and it's a little unfortunate that our national conversation has devolved to that.
Absolutely. I understand that. And that's very interesting given that, you're in Houston versus, I'm currently located in Los Angeles. Not a similar conversation that I heard. So it's just very interesting, how the discourse has evolved, which I would like to do another switch, public health discourse. So Sana, in the time that you've been in public health, what do you think is missing from the public health discourse, either in the States or abroad?
I think something that was present but maybe got pushed to the side is um, making sure that women's health is looked at from an intersectional lens, right? So I know, so we're talking about health equity. Like this is all like Boston Congress of Public Health is so focused on health equity, and it's become such a hot topic, especially because of COVID. But just like, you know, the whole blue red state kind of thing, we can't, it's much more complex than that. And looking at women's health and children's health from an intersectional perspective has kind of been glossed over in the past few years, right? Health equity is such a broad term, and it does a disservice to the communities that we're trying to serve by kind of lumping everyone and every issue together.
Absolutely. Could you say a little bit more about that, like issues that are lumped together versus those that are more, I guess, delineated and differentiated?
I'm not sure what you're trying to say, Candace. Sorry, if you could kind of elaborate.
Yeah, no problem. So I guess we were talking about women's rights or reproductive rights. Was there certain issues in particular that you felt were lumped together as opposed to kind of made more distinctive in that area?
Yeah, so yeah, that helps. So I think I guess going back to the abortion rights thing, because I've been going to a lot of rallies and like activist groups and meetings since then, we're lumping together, for example, if we're talking about abortion rights, we're lumping together all women together when the reality is that women who have greater access to economic resources or who are not women of color might have ease can mitigate, you know, the health inequities and the barriers that other women might have to get access to abortion, right? So it does like do a disservice to women of color or immigrant women or women who are not don't have the resources at their disposal when we just kind of say women's health, for example. That's kind of what I was trying to get at.
Absolutely. So not viewing women as a monolithic entity.
Exactly. Yeah.
Okay, awesome, awesome. Sana, as a 40 under 40 BCPH winner, how's your life changed since the award?
To be honest, not much, Candace. I don't know if that's the answer you're looking for. I think for me, though, personally, like maybe not socially or whatever, but personally, I think the award and being awarded as such has given me more of a motivation to envision what I want to do in my next 10 years, right? So like that's why you have bucket lists, right? So I made a 30 before 30 bucket list. And after I turn 30, I'm going to make another one, a 40 before 40, just because doing something like that or receiving, like, you know, being listed like that gives you the fire and motivation to do, okay, I got this much out of being like 28 and achieving this award. Before I hit 40, I want to kind of challenge myself and ramp it up so I hit this milestone. So for me personally, it's been a big motivating factor.
Ooh, so I can't help but bite at that one. So then, Sana, in the next 5, 10 years, what are some milestones to achieve, I guess, in public health?
Sorry, can you repeat that? I apologize.
Yes, in the next 5 to 10 years, what are some of the milestones that you're looking forward to hitting within public health and or otherwise?
Yeah, so I am a director of operations at a hospital. Um, you know, a little selfishly, I can't envision myself being in the C-suite in 10 years, fingers crossed. But I think more generally, I definitely see myself as an advocate and leader in incorporating and mainstreaming health equity across the American healthcare system, right? And not just as an offshoot or a secondary topic. Unfortunately, what I'm seeing on the ground is while we as academics or people who, you know, as academics and researchers, we like to think of health equity. We talk a lot about it, and therefore we think that everyone thinks about it, right? But on the reality is that that's not a concern or something that folks on the ground really think about, right? Like I can tell you right now, a lot of these conversations that I'm having is, okay, yes, health equity, it's nice to have, lowering access to care, making sure like the homeless guy or the unhoused guy, excuse me, who walks into our ER has the proper resources. But then how does that balance off with like our staffing needs? Like, do we have the staff to help him? Do we have the resources to help him? Right. So trying to incorporate health equity into every conversation that you would typically have and not just thinking of it as a nice to have or an idealistic um, ideal to aspire to.
I absolutely love that, and you answered the question that was on my mind is, whether, for you it's part and parcel of anything, right? The from building the actual patient room, to staffing needs, to exactly how patients might have an intake, etc. And do you you know do you have hope and think that health equity can be something that's part and parcel, or do you think that the struggle is real, and that it will continue to be mutually exclusive, say, to the design of hospitals or other things?
You know, I'm in two minds actually. I can tell right now, as a lot of hospitals and health systems are kind of recovering after COVID, that it's not included, it's not incorporated. But I do think that we're at that turning point, just not in like the healthcare system because of the pandemic and the stress that it's done on hospital and other health systems, but also because of what's happening socially, right? Like there is an increasing awareness across the board about issues of equity that just weren't there 10 years ago, 5 years ago, or even frankly 2 years ago. So I'm hopeful that we're at that like pivotal point where we start not just talking about it, but taking it more seriously. Um, I don't think we're at that point like today, but maybe within the next 2 or 3 years.
Absolutely, I love it. Go a little bit more into health equity, for the lay audience. You gave an example of the unhoused person coming into the ED, and what that person's experience would be the same as, say, someone who was housed. But can we talk about some of the other health equity issues, that are top of mind for you, or that you've talked about, besides just like the housing issue?
Yeah, so I think our strength, at least at the hospital, is the clinical strength. So we've been thinking through initiatives and opportunities to, for example, partner with local churches and mosques to make sure that people who don't have a regular PCP because they may not have insurance because they may not have a full-time job, and that also kind of indicates where their socioeconomic status is. If their place of worship can help screen for diabetes or high blood pressure or whatever, like have a regular, clinic at the place that they are most likely to go, and that isn't an added step for them, so they don't have to take time out of their day to come to the hospital or come to our clinics and actually do everything. I mean, if they go on Sunday to church, they can, their reverend or pastor can actually help us make sure that their congregation gets screened. So I think mainly I am thinking about it in a more clinical sense at the moment, because that's where the strength is of the organization, and that's where we can actually justify it realistically. In the future, we really do want to branch out and go into more social determinants of health, maybe by investing in an anchor mission project, which we are actually looking at. And an anchor mission project is basically the hospital situates itself like an anchor in the surrounding community and really makes a commitment to invest, hire, and source material from the surrounding area. So your security guard would be from the community. The mats that you may need when it's rainy so that people can wipe their shoes off, you'd get it from a local sourcer. So that's the direction we're moving in.
That's very interesting. I've heard that concept before under a different name. Is this possible, for larger academic centers as opposed to just community hospitals?
I think it's a bit more possible for academic centers. It was started by Rush University Medical Center in Chicago, where I previously actually also interned. And when I worked at Boston Children's, they have a very robust anchor mission initiative at the hospital as well. So yes, I think ideally, at least conceptually, academic centers are where many of the present anchor mission hospitals are, but we want to push that out to more local hospitals as well.
Oh, I think that's absolutely fantastic. Love it. Anchor mission with hospitals. So, Son, as one of the last questions, you're a 40 under 40 BCPH Public Catalyst Award winner. What do you envision for your cohort and cohorts to come?
That's a good question, and that's a pretty big question, Candace. What I envision after reading everyone's stories, the little profiles we have on the website, I was seriously impressed, right? Like, wow, what a cohort to be a part of, and I was honored to be a part of it. I can see each one of my colleagues being a leader, not just in the US, but also internationally, in each of the different routes that they have chosen. And it's pretty unique how you selected folks, because there's no two people that have the same path or have the same vision or journey going forward. The one connecting theme is, a determination to achieve health equity and an emphasis on social justice, which is, I think, a mainstay of any public health or healthcare related career path. But I envision all 40 of us and the coming cohorts to be the folks you see in newspapers or in journals or on TV, having news conferences, and really leading the rest of the world in public health.
I love that. And Boston Congress of Public Health would be more than humbled to have helped to identify and to give a platform and somehow played a small part helping to elevate all of you to be able to do that. So we thank you so much, Sana, for this interview. And for those of you who are listening, if you want to learn more about Sana, the fantastic work that she's doing in operations and health equity and much more, go to bcph.org at 40 under 40. And if you want to learn more about social justice and other public health issues, you can go to our journal, HPHR Journal, formerly the Harvard Public Health Review, at hphr.org. Once again, thank you so much, Sana.
Thank you, Candace.